Welcome, everyone. I'm Dr. Christy Billock, and I am a professor and the founding program director of our Occupational Therapy Doctorate at Keck Graduate Institute. And I'm so grateful to have you all here today. And what I'm planning on doing is giving you just an overview of occupational therapy, and then I'll share kind of the developing threads of our occupational therapy doctorate at KGI that will be beginning in fall of 2022. So I would like to just, please feel free to type this in the chat. Is occupational therapy something that you're just newly exploring, or is this something that you've decided that this is what you want to do for graduate school and as a professional path? Because it just would be helpful for me to know where each of you are at. So are you new to the idea of occupational therapy, or have you decided this is definitely what you want to do?
I guess I can just share.
Yeah,
I know
thank you.
for me, it's just something that I've decided that I want to do. So I want to start applying either in like the summer or whenever it would be the appropriate time.
Great. Thanks for unmuting. And please, anyone, please feel free to unmute at any point in time here. And Dr. McNair, it looks like you do the important work of helping guide students into graduate programs. So welcome. That's a really important role that you're playing as well. So I want you to all feel free to unmute, raise hands, put things in the chat. Let's make this as interactive as possible. My guess is that you all have been spending a lot of time on Zoom in recent times. And I know I have too. And you know, it's been over a year now that we've been doing this, and I still miss the human interaction, you know, so much. So if we could make this as interactive as possible and informal, because what I want most is that you all leave with just a clearer understanding of OT and our program specifically. So please feel free to speak up in any way that you would like, or not. If you want to just sit back and listen, that's totally fine too. So I want to tell you a little bit about my story as an OT. And as you venture into learning more about this field, you'll learn that everybody has a different story within the profession, because we are so broad. There's so many different things that you can do as an occupational therapist. And I always think it's fascinating to hear what people's stories are. So I graduated from Loma Linda University in 1995, which is a long time ago now. And back in the day, you only had to have a bachelor's degree to become an OT. So that's very different than where we are now. And this is true across many healthcare professions. Physical therapy was the same, you know, a bachelor's degree would get you into the profession. So I graduated from Loma Linda University. My clinical background is working in inpatient rehabilitation. And I worked in inpatient rehab for several years. And I really, as a new grad, I felt like, oh, I know what to do here, but I want to know more about the big picture of what occupational therapy is about. So I went back to school and I got my master's degree, a post-professional master's in occupational therapy from USC. And then at that point, I was contacted by Loma Linda, my alma mater, because they were looking for people to teach. So I started my teaching career with them, and I'm now on my 23rd year of teaching. And so I started just doing it adjunct and kept working clinically, and then transitioned into a full-time teaching role. So I spent 14 years at Loma Linda University teaching, and then was at West Coast University for 7 years after that, before coming to KGI to help start this doctoral program here. So I've been in the game for a long time. and ended up along the way getting a PhD in occupational science from USC. And my area of interest was and research was looking at women's experience of spirituality in everyday life. So within the world of occupational therapy, spirituality and occupation is kind of my area of expertise. It's where I've published book chapters and created an assessment, and that's kind of one of the things that I've been really interested in on this path. So I've helped transition a program from a bachelor's to a master's degree. I've served as a consultant to starting doctoral programs. I helped create a post-professional online doctorate program at Loma Linda University. And I feel like it's important to tell you all this because we are a new program. And when we're starting out, this is a relationship of trust, right? Of you as potential students saying, I'm really interested in the way that they're going to educate there, but it's a little bit of a leap of faith because we won't have accreditation until that first cohort graduates. So I'll talk more about that. So I just want to tell you, I've been through accreditation many, many times, and I think the program is in good hands. And I've been really thoughtful about who's being hired as faculty into the program to help us just create a really outstanding program here at KGI. So I have a PowerPoint to share with you. So I'm going to share my screen. And then we'll just kind of go through some basics about occupational therapy, because I love just talking about what is this thing that our profession does, and how can we talk about it to other people? How can we better understand occupation in our own lives? Because I think these are questions that really help inform making this decision. So I call this OT 101, and some of you might already be pros at this, but I think it's good to just be reminded, what is it that we do in occupational therapy? So from our practice framework, we had a new one that came out last year. Occupational therapy is just defined as the therapeutic use of everyday life occupations with persons, groups, or populations. And our purpose is to enhance or enable participation. So we believe that being able to engage in those everyday life activities is vital to health and well-being, right? So the center of our practice is occupation. And so here's the thing about occupation. Occupational therapy was developed, it became a profession in 1917. And back over 100 years ago, occupation meant something different than it does now. And so maybe when you've talked about being interested in occupational therapy with friends or loved ones, they might say, occupational therapy, do you help people find jobs? Right? And that totally makes sense, right? For the way that we use occupation now, which is usually occupation refers more to the work that you do. But back in 1917, it was defined as just everyday activities that people do to occupy their time. Okay. So at the heart of this, we believe that what you do every day really, really matters. And for some people, you might think, oh, we just like, this is just the simple, easy part of life, right? These everyday things that we do. But to occupational therapy professionals, we believe actually it's like incredibly complex. There are so many different factors that go into what people do every day. And it's vitally important that people are able to do the things that matter to them to be happy and healthy. So within our profession, AOTA had something called Vision 2025, okay? And I'm just, oh, good, I have this afterwards. It's like, where did that slide go? So Vision 2025 is from the American Occupational Therapy Association. And we as a profession have really just been rallying around this vision since 2017, as saying we really want to be seen and be an inclusive profession. And our whole point as occupational therapists is to maximize health, well-being, and quality of life for all people, populations, and communities. You see that again. So we like to think about not just working with individuals, but groups as well. And we are those experts that can find solutions to help people live their everyday lives. And I'm going to talk about wellness and prevention and lifestyle medicine later in this talk. And you can see that in our vision here, that is an important piece of this, that we get to maximize health and well-being for people, whether they have a condition or not. So I'm going to ask you this question. What did you do this morning after you woke up? And you can unmute yourself or you can put something in the chat. Just what is something that you did when those eyes opened up in bed? What were some of the first things that you did this morning? And I can tell you there's no
I know
wrong.
for me, I wake up, I brush my teeth, wash my face, go to the bathroom, make breakfast, you know, the little things in the morning.
Yeah, so there's like some hygiene and grooming that's happening. Vanessa, you drink some water. You want to get some food when you first wake up. I have this. You went for a jog. Josh, you were good and healthy. I was out walking this morning, watching the people jogging, Josh. And I was like, oh, I remember those days when I used to go for a run instead of a walk. So yeah, so you did some, well, I think everyone is doing some things to like promote their health and well-being. Did any of you interact with something like this morning when you woke up?
Yes.
I call this my phone friend. We have a very challenging relationship because I think in many ways this thing makes my life better, and in many ways it gets in the way of my health and well-being. So yeah, I wake up and I know they say you're not supposed to do this, right? Have that phone in your bedroom, but it's on my nightstand. It's playing white noise for me as I sleep. I pick it up, I scroll through Instagram, look at the news when I wake up. So yeah, so we've just in the last minute or two here, we've made a whole list of occupations, you see? And if say Marina was my client or my patient that I was working with, I would want to ask these questions of what does a normal morning routine look like for you? And when she says, I get up out of bed, I go to the bathroom, I get water, I would want to start asking those details of like, say there was some kind of accident where she had to use a wheelchair or a walker, we would want to try to problem solve. What is the accessibility in her bedroom? Being able to get to the kitchen. Would she be able to make breakfast? And maybe you're a cereal breakfast eater, Marina, but maybe you love a really nice omelet for breakfast, right? That's a bit more involved. So I would, as your occupational therapist, just want to ask all these questions. And then we would start problem solving solutions together to make sure that you could do every single one of those occupations, right? Because all of those things together really set up what's really important for you in the rest of the day too. So morning is always a kind of a time that OTs, we really oftentimes will focus in on that morning routine first with someone, like in a rehabilitative setting, right? So here's the other thing about those things that you did this morning. And Josh, I really like how you said like you jogged this morning. So here's the thing. We all open our eyes in the morning and we are faced with hundreds of decisions about how we are going to spend our time, right? We have so many decisions to make. And some of the decisions that we can make can help us be healthier. And some of those decisions can make it maybe aren't going to be so healthy for us, right? So as OTs, we care about helping people navigate through the complexity of all that decision making. I know after lunch today, I was like, I would like to make the decision of ending my lunch with a glass of water, but we still have some residual chocolate in the house from Easter. And I'm like, oh, I didn't make the best choice around the chocolate, right? So these are the things. Everyday life is complex, and we are the professionals that can help people navigate that complexity. So let me move forward here, and my slides are frozen. this happens sometimes. Here we go. So at the center of our profession is this idea of occupation. So we can help people develop new habits. We can help them rehabilitate skills that they had in the past, and then do prevention and wellness. In OT, we work across the lifespan, from babies in the neonatal intensive care unit to children in schools. We do early intervention, in those first years of life, and then every age all the way up to older adults and the end of life. We are a research and evidence-based profession. We have been very, very strategic with our use of research, evidence, science, and theory from the founding of our profession. And it's the reason why the profession of OT just continues to grow and grow and grow, because we've been very proactive in making sure that it's very clear the value of the work that we do. We think that meaning really, really matters. And so when a person has a stroke and they need to get back to life and doing things that matter to them, we have to talk to them about what these activities mean to them. We can't just say, oh, every person that's had a stroke, we are going to do X, Y, and Z with them, because meaning matters. And for some people, being able to do, maybe do the occupation of gardening might be the most centrally important thing in their lives, right? Or being able to care for their grandchildren, or being able to care for their pet, right? So we have to talk to people and learn about, what do these activities mean to you, right? We believe that environment is really, really important. So very often we will work with patients or clients that we can't necessarily change their skill level, right? If we're working with a child with cerebral palsy, we might not be able to improve those motor skills, but what we can do is we can look at the environments that the child is living their life in, and figure out, how can we make adaptations to the environment to make it more supportive, so that child can be more successful in their daily activities. So we look at the person, but we also look at the environment too. And that can include physical environments. It includes the community at large, families, all of those things. We are also a justice-oriented profession. And coming out of the work of occupational science, we developed a whole area of theory and research called occupational justice. And this is just the idea that we believe that every human being has a fundamental right to be able to engage in everyday activities. And there are some people who are deprived, we call that occupational deprivation, where they aren't able to do activities. Sometimes people experience occupational alienation, where they might be doing occupations or activities that don't hold a lot of meaning for them. So we take this kind of justice approach when we advocate for people with disabilities to have the rights to be able to engage in occupations like other people. And that's something that really historically has mattered a lot to us in the profession. So where do OTs work? The largest area is in hospitals. They also work in long-term care facilities. And in my career as an occupational therapist, we've seen a shift from a lot of rehabilitation happening in acute rehabilitation settings in hospitals, shifting more to long-term care facilities. So a lot of rehabilitation now happens in those long-term care settings. A lot of OTs, 20%, work in schools. Outpatient is another option, where patients are living at home, but then they come in for services in outpatient clinics. And that can be in working with adults or in pediatric settings. Home health is another area where OTs will go out to the home, and this is kind of like the playground, right? Because everyone's occupations are just right there in that environment. And then academia is another one. 6% are teaching, like I am, early intervention, and then OTs also work in mental health. So part of our training as occupational therapists is in mental health. And we hold that as really important in our developing program here at KGI, because we recognize that mental health is kind of the foundation of everything. And really any diagnosis that a person has might have some mental health issues going along with that. So we as OTs are always looking for that. And then community-based settings are another option, where there are a lot of emerging practice areas where there might not be OT now, and OTs find like, oh, this could be a really valuable service to, say, like people who are homeless, people who have gone through domestic violence, and that kind of gets categorized in this community category. So any questions so far? Everybody good? All right, just feel free to unmute or raise your hand or chat if you have any questions along the way here. So you can become an occupational therapist with a master's degree or a doctorate degree. So a couple years ago, the profession was going to transition just to being entry-level doctorate, and there was a lot of pushback about that. So now it's dual entry. You can get a master's or a clinical doctorate. For what we are deciding to do at KGI and the mission of our institute, we have decided to go with the entry-level doctorate here. And you're looking at 2 to 3 years of graduate education. When you're done, you become an OTR. This goes after your name. That's a registered occupational therapist after you pass boards, and then you get licensed in whatever state that you're living in. There's also a career path to be an occupational therapy assistant, and that is with an associate's or a bachelor's degree. That's just 1 year of education. So what is median salary? So you're looking at about almost $89,000 a year for an occupational therapist. And again, that goes higher and lower. Salary rates tend to be a bit higher here in California than other states. And it just kind of depends on what area of practice you're in. An occupational therapy assistant, it's $59,373 is the median salary there. So you might ask, what would make me a good OT, right? So at the very top of the list is a desire to help other people. And so I really feel like occupational therapy is a calling, and people who choose to pursue this profession understand that their work is really valuable. The job satisfaction rates for occupational therapists tend to be very, very high, because every day at your job, you can see that you're making a difference in someone's life. And if you are working, like the setting that I worked in clinically, in inpatient rehabilitation, I was working with people who were kind of at the lowest point in their lives, right? Where it's just really, really challenging. Oftentimes it was an accident. There could have been a trauma that brought them in. I worked with a lot of people and young people who had spinal cord injuries or traumatic brain injuries, people who had strokes, people who had to have joint replacements, or people who were living with chronic diseases that got them to the place where they needed rehabilitation services. So you're getting to, and I feel like it's a privilege to work with people at that state where they're like, life is really hard, and you come in and you offer them a view of what the future could look like, right? And you say, look, there's possibilities here. You're going to be able to do some things on your own. You're going to be able to get back to your life, right? So that really is such a valuable way to make a difference in the world and to help other people. Dr. McNair, AOTA recommendation, yes, that has been tabled. That has been tabled. I'm reading in the chat here that yes, we are not transitioning only to entry-level doctorate by 2025. In the new standards that came out, that was tabled for now. So for an OT professional, it's mission critical that you appreciate and embrace diversity, equity, and inclusion, because we work with people from all walks of life. and experiences. And that's part of the joy of the work that we do, is that we get to learn so intimately about other people's experiences. And our job is always to respect that and to, again, just really have a deep appreciation for that. It's what makes our job so interesting. You know, you might have 8 patients that you're working with in a day, and every room you go to, it's going to be a different story, a different type of therapy that you do with them. And it's learning every day, right? So we believe, we're very optimistic about humans, and we believe that people are able to change, and that we can help give tools to help them make changes. And then of course, we need to come with big hearts into this, with compassion and being flexible, and understand that we are going to keep on learning as we go along. So, okay, I'm a little bit stuck again. Here we go. We don't work alone. And if you're like me, I don't like working alone. I like working in a team. I like working with other people. So kind of at the top of the list here are people that we most often work with. And again, I'm thinking from a hospital perspective here, but physical therapists and speech therapists, nurses, physicians, like this is the core team. And it's so great when you have a really complex person, like a complex situation where you're looking at a person who has a lot of limitations, and as a team you get to come together and say, how can we help get this person back to living a life that is going to make them happy, right? And we don't do that alone. So you can see, just depending on the setting, there's a very wide range. Of course, in schools, the OTs are working very closely with teachers. Yeah, so there's just lots of possibility for collaborating with other professionals. So our program at KGI this is just kind of an overview here. We are going to be preparing scholars and innovators of practice. So innovation is really important at KGI. And as I have helped shape this, I've been at KGI for 1.5 years now. And a lot of the work that I've been doing is been focusing on how are we going to create and deliver a really truly innovative program where our graduates are going to be able to go out and have a distinguished career and do things that might be beyond what other programs might prepare them for. The top of the list is clinical excellence here. We want our graduates, my dream is that fieldwork sites start to ask for KGI students because they come so well prepared, right? So our mission is to educate future OTs through this transformative and dynamic educational process. KGI highly values active learning. So even though you are sitting in and hearing a PowerPoint right now, not all your classes would be like this at KGI. We will educate, and we will move into active learning and go back and forth between some of that critical lecture material, but lots of interaction, lots of group work, lots of hands-on experiences in classrooms and labs. So our vision, we envision that occupation is the answer to a lot of the problems that we have in the world, right? So we believe that there's just a lot of innovative potential out there for being able to utilize occupation to help people in a lot of different scenarios. We could make a list together right now of a lot of problems that we have in the world, right? The list is pretty long. I think at the top of the list, probably we put living through a pandemic, right? And I don't know about you, but it's been very hard to be away from friends and family during this time. Just the isolation has been really tough, right? So I'm always thinking about this experience through the lens of occupation, right? And what do we have to offer as occupational therapists to help support people's health and well-being through this time of living isolated through this pandemic, right? So we could go on about, we have so many problems with people who have obesity, who have lots of chronic diseases in the United States that could be prevented. And in my mind, I'm just thinking, oh, all roads lead back to what we do every day, right? So our hope is that our graduates could go out and start solving some of these problems, right? That they'd have the preparation to do that. So our first cohort is starting in August of 2022. The goal is to have 40 students per cohort. We are hoping to have 10 faculty members. That's including myself. We have already hired an academic fieldwork coordinator. We have a capstone coordinator that is going to be starting at the beginning of May. And we have another faculty hire that's going to be happening this summer that I'm going to talk about in a minute. So our credits are going to be around 118, and it is a 3-year doctorate. It's actually just one semester shy of a 3-year doctorate. So you start in fall, it's a fall of 2022 start, and then graduating in spring, that's in May of 2025. So 2 summers in the program instead of 3. So what are our curricular threads? So these are the things that a student, these are going to relate to our program learning outcomes, and these things are going to be streaming through our whole program. And what there's going to be is a big emphasis on occupation being the center of our practice. So yes, you're going to learn how to do range of motion, and you'll learn how to do therapeutic exercises with people, but we're always going to be asking that question, what are you doing it for? And that's when you say, oh, I'm doing this because Marina really wants to be able to make an omelet in the morning, right? Or Josh really wants to go jogging. So that's why we got to work on the range of motion and that sort of thing. So all roads are going to lead back to occupation, which makes life super interesting and fun as an OT. That's where all the creativity comes in. We're going to have a strong research and evidence-based practice approach where students will learn how to read the research, apply the evidence, and do research themselves. So students will be in research teams of 4 to 5 students at a time. You will have a faculty mentor and a faculty member that teaches the faculty course and walks you through every step of the research process. And that will span over 3 semesters. And at the end of it, the goal is to have something that students could go present at conference or perhaps get a publication out of, and really contribute to the larger body of knowledge within occupational therapy. So clinical reasoning and therapeutic use of self is going to be a really strong thread. In OT, we are what makes therapy effective or not. And we want our students to be able to think on their feet and be flexible and really understand that how they connect with other people, how they solve problems is really a critical piece to what we do. Health, well-being, and wellness is going to be a really important thing. I'm going to talk about this more in the next slide when I talk about lifestyle medicine. We want to graduate leaders and innovators and advocates within the profession. It's important to note that leadership can take many different forms. It doesn't mean that you're always the one up front that's talking, but really looking at the skill set of each of our students and helping them to develop and become contributors to the profession as a whole. And then we are always going to have this health equity and occupational justice lens. And in our curriculum, in the first semester, there is going to be a course called Health Equity and Occupational Justice, where we talk about the social determinants of health. We really look at these, like the social constructs of disability and other factors that are justice related. We will be looking at implicit bias and anti-racism and really have this in our minds as we move through the whole program. So some of our key initiatives, we at KGI have a master's in medical device engineering. And one of the reasons that they wanted to start an OT program in the first place is they wanted to have collaboration between occupational therapy students and medical device engineering students. Because here's the thing, OTs have great ideas all the time, but we don't necessarily know how to build the things, right? And engineers know how to solve a problem, but they don't know what the problems are. But OTs know what the problems are, right? So in the curriculum, we're going to have a few different touch points where our OT students are able to collaborate with the engineers to develop assistive devices and solve problems likely in if this was an area of interest to you in your capstone project, you could really get into this assistive technology piece and partner with even with some of the faculty who teach in the engineering program. Lifestyle medicine is going to be a really big part of what we do. So I just got a grant, a $76,000 grant that is they have funded us to create the first integrated lifestyle medicine and occupational therapy curriculum. And so we are going to be having lifestyle medicine thread through our entire program. We are going to be writing a textbook also that hopefully will be used in occupational therapy programs everywhere, because we're going to make it open source, because we really like textbooks to be free when they can be. Hopefully that's a happy thing for you as a student. So we're going to be writing a textbook on lifestyle medicine and OT and threading this through our program. So lifestyle medicine is a movement that was started by physicians in the US. And so it's a group of health professionals that are saying we need to change the healthcare system. Because do you know 80% of the reason people go to the doctor is because of preventable reasons. And as OTs, like lifestyle is at the heart of this, and we are the experts in everyday life, right? Are the light bulbs going on? You're like, yes, this is what we should be doing. So in our curriculum, when you learn about strokes and what you would do for intervention, you're also at the same time going to be learning, how can I help the person, teach the person and work with the person so we can help prevent the next stroke from happening, right? And how could we go out and work with communities and populations to do prevention work? I think I am a firm believer that this is the future of healthcare, and we're starting to see some shifts in reimbursement, and we want our students to be ahead of the curve and be able to provide these services in the future. So that is going to be a big part of our program. Also, innovative clinical skills. I already have some partnerships with a company out of Canada that's created a protocol for working with people with mild traumatic brain injury or concussions. And they are the founder of the company is currently working with the Canadian Olympic team, with the National Hockey League up there, but this is not available yet in the United States. And guess who they want to partner with? KGI. So our students are going to be trained in that Apex K protocol is the hope. I'm hoping to become involved over the next few months with a research study, along with someone from Harvard Medical School, a radiologist there, and Apex K. And we would, from KGI, would be kind of the central hub for teaching this protocol. And so that's just one example of innovative clinical skills. We're going to have our students really well prepared to work with an oncology population, because you guys know cancer is now considered a chronic disease, right? It's not the death sentence that it used to be. And there's so much possibility for OTs to be working with this population, and we do. And we're developing a close partnership with City of Hope, and they have a whole team of OTs there. Our program is really gonna just provide excellent training in rehabilitative oncology. And then we want to be out in the community, because when we look around us at what's happening in the communities, there's so much need in the world right now. And we want to be able to go and look at the community around Claremont and say, what are some of the things that are needed? We know that there are a lot of people who come to Claremont and retire. So there's lots of aging, the aging population is there. There's lots of young families in Claremont. There are a lot of pediatric OT clinics actually close that we've already been talking with a lot. And we're just asking ourselves, how can we prepare our graduates to be able to meet the needs of communities and give them fieldwork experience to be able to do that? So those are kind of key initiatives. Like I said, we are almost 3 complete years long. And the first 2 years are didactic. And then the third year is going out for 2 level 2 fieldworks and a doctoral capstone. This is just kind of an overview. In our program, students will be going out every single semester of the program. So from semester 1, you'll be going out into community-based settings. And of course, we don't send you out and say, oh, figure out how to do stroke rehab your first semester, right? So it's very closely aligned with what's being taught, with what you'll be asked to do as a student. But you'll be able to spend 40 hours out in a fieldwork setting, working with actual people. And in semesters 2 and 3, that will be with adult and older adult populations. We are teaching pediatrics over 2 semesters. In some programs, that's only in 1, but we feel like there's so much to teach. We're going to teach it in 2, but have that fieldwork really concentrated in the 4th semester. And then the 5th semester, students are going to go out and offer lifestyle medicine interventions, run groups, work with individuals, but really utilize that lifestyle medicine training that they get. And that might be with a pediatric population, it might be with older adults. The age range will be very wide. So then you go out onto 2 12-week fieldworks, and then semester 8 is your capstone. This is an individual project where you go to a setting for 14 weeks. It might be a setting where there's no OT, right? It could be an experience where you think, oh, I really think that actually the place that so maybe you worked in a business setting before, and you saw that a lot of the employees that you were working with were just really suffered from burnout. They were having a hard time staying healthy. And you, for your capstone project, you might create an employee wellness program. And you would be there for 14 weeks. You would create the program. You would go through a whole proposal process where the faculty and the capstone coordinator would help you with that. You deliver your program, and at the end of it, have some kind of scholarly deliverable that you might present a poster at a conference on. You might work that into a publication. You might choose to do a research study. So this is what the capstone looks like. Our accreditation process, December of this year, we'll be submitting our candidacy application. And so we're in pre-candidacy status right now. We have candidacy status that we'll be turning in the application April of 2022 of next year. ACOT will make the decision about whether we are granted candidacy. And at that point, after they decide, and I'll say this in the next slide, that's when we can formally admit students into the program. And then once we have our first cohort, we start preparing the self-study. We work on that for a couple years. ACOT comes on site and decides whether we get accredited or not. So by March of 2025, the hope will be that we will have full accreditation by that point. And this is a timeline that is put forth by our accrediting body. So we are utilizing holistic admissions. We want to hear your stories about what your educational journey has been. We want to have a very diverse student body. We think the more diversity we have, and diversity takes many, many different forms, the better we are as a program and the better the profession of occupational therapy is. So on our website, we have the admissions criteria. You can start applying to our program in July of 2021. It's coming up fast. We are going to be on the OTCAS system, which is kind of the central application system for OT programs. We'll be doing interviews with qualified applicants in February to April of next year at this time. And then we'll be able to notify people by the beginning of May in 2022. In August, people come on campus. That's going to be the fun part. So if you are interested in knowing more about our program or occupational therapy in general, we started last summer our pre-occupational therapy program, and we are offering that again this year. And that is, we extended it from 3 days to 5 days because there's just so much to talk about. And these are, you can see our session dates here. It is free, it is online. It is like 6 hours a day of hearing more about the profession of OT. You will hear from people practicing in all different practice settings. We bring in students that are currently in OT school. We bring in some recent graduates to talk about what it's like to take boards and transition out into the world. We give you some experience of what is it like to be in class as an OT. So you learn some of the content that you learn in OT school and have a chance to just kind of see what that is like. And then here's our disclaimer about accreditation that you can find on the website there, just how to contact ACODE and that sort of thing. And we're also applying for a substantive change through WAS. So that's all I've got. I'm going to stop sharing. And I saw some questions came up in the chat. Oh, Kamika, you were just posting. Okay, awesome. All right. So do you have any questions that I can answer? And feel free to just unmute yourself or raise your hand or whatever you want to do, put something in the chat. But can I answer questions for people?
So if your program reaches candidacy, does that mean that when, for example, we were to take the test if we're the first cohort, does that mean that we would be board certified for sure, like no problems or anything?
So that comes with full accreditation.
Okay.
But if we pass candidacy,
Uh-huh.
it's ACODE saying you got a really good shot of being accredited. And I can tell you that it's not 100% sure thing. I can't say that, but I know the accreditation process really well, and ACODE as an accrediting body is not out there to get programs in trouble. That is not their approach. Their approach is to help programs be better and to ensure the quality of programs. So it's not the kind of thing that it's like, oh, 50% of new programs don't become accredited. It's actually a very small percentage of new programs that don't become accredited. So
okay, thank you.
Yeah, sure. Other questions that I can answer? I know I gave you a lot to think about.
You mentioned that the best way to present yourself in an application is to tell your educational story. What would set a candidate apart as a, outstanding candidate for this program?
An outstanding candidate for this program would be someone who is really ready to just have an open mind and be curious and ready to really forge some new paths within occupational therapy. We want to see, so I'm going to say this, I am naturally an introvert, okay? And so I'm not saying that everyone needs to be like the president of a pre-OT club and stuff like that. But we want to see, it's really great when we see students that have really gone out of their way to have some experiences that would relate to the work of OT, but also equally important that we see a process of a student who is being reflective about their own life experiences and how those experiences could be valuable to being a professional, becoming an OT professional. And that could be, telling the story of a sibling who had a disability and what was that like, being a family member or being a caregiver for a family member, like a grandparent that had a stroke, or, working in a summer camp and working with children and just having ideas about how relating to other people is so important to the work of OT. So that helps. I mean, we will be looking at GPA, but GPA is not everything for us. And we are not requiring the GRE in this program. You do not have to take the GRE to get in. And that part of that decision is coming from a justice perspective, because I don't think that doing well on those tests, it's not fair to all people who take them, right? And it just doesn't seem like the best indicator of whether someone's going to be a good OT or not. So it's really important that we see that potential students have that reflective skill of being able to look at their own experiences and be able to say, oh, I see how this could relate to the work of an OT. Does that answer your question?
Well, yes, and I have a follow-up, but I don't mean to take the whole platform.
That's okay.
So I am working with this student who shifted from pre-med to OT. She's incredibly passionate about it. So she's still doing health science, but then she's matching with that with a major in sociology, which sounds like
Wonderful.
a great preparation. She
Yep.
currently works by choice in an assisted living facility,
Awesome.
and she's the receptionist.
Mhm.
But I said, you need to do more. So I said, is it possible you could shadow the OT when they come in? Of course, she'd have to navigate the hours and how that works because she'd be away from the desk. But right now, that OT is coming every day to that facility. It's not even like she'd have to figure out exactly those 2 hours on Friday or whatever. So other than what she's doing, she's concerned about getting some research experience, psychology related research with her favorite psych professor.
Yeah,
And
that's
she's,
awesome.
yeah, and she wants to do some actual either shadowing or some other thing. Again, she's like a third year. Anyway, she to finish the double major, it'll take her 2 more years. But what else, and what would I encourage her to do specifically that might be applicable for other people on this meeting to get in
So,
there in where she works to get some real experience to the extent that that's acceptable?
right. So most OT programs are going to ask students or applicants to have shadowing experience with an OT. And we are not making it mandatory, but it's highly encouraged. And so what's great about shadowing is, yeah, you see firsthand if this is something that you would like to do, right? And I think it's great if you can try to do it in a variety of settings. And certainly in our COVID world right now, it's very challenging to get in and do your volunteer time. So shadowing is great. I think that even just having the job of being a receptionist in a assistive living setting is fantastic because she's interacting with a lot of people and kind of getting to know the lived experience of people who live in assistive living, which is, I can imagine her in OT school already being, having some good insight about that. So if there is interest in a particular population, like if you're thinking, I really want to work with children, any job that you can get in a pediatric setting is going to be helpful for you, right? But definitely you do try to seek out those shadowing experiences in as many different settings as you can.
Okay, so if she's got more flexibility this summer, then would you say like 5 to 10 hours a week, or maybe 20 hours over the course of the summer? What would show that she had a commitment to shadowing?
Yeah, I mean, 20 hours is significant. 40 hour, I mean, a lot of programs put numbers on the amount of hours, right? But if it said 1 to 2 hours, I'd be like, oh, that's not very much, right? 40 hours seems great, right? 20 hours seems like a good chunk of time to really get a feel for what's happening. Yeah, so it would be more in that 20 to 40 range. It does not have to be 400 hours, right?
Well, yeah, a PA
Yeah.
program is looking at what, 2,000 hours. So,
Yeah,
but
no,
that's not
that's
really shadowing.
no. You
So
don't have to do that much.
if she did that in the place where she's currently employed, then you would encourage her to go to some other place to do additional shadowing in a PT environment, whether it's clinic or hospital or somewhere in home or something else where she works with a different population.
Yeah, just any place where OT services are being offered is helpful. And
Very good.
that range is pretty wide. So
Okay, thank you very much.
you're welcome.
I think that I had seen on another OT school's website that in California, you have to do your field work in California. Is that true for a KGI or no?
That's not strictly true. So
Okay.
so there's a something called the SARA laws, and there's this group. Unfortunately, California is, I think, the only state now that's not part of NC SARA, which says you can provide education across state lines. And so in California, OT programs do send students to other states, but they have to have an arrangement with that state. And it's fairly common within OT school to not be right in the immediate area of where you're going to school. And I kind of think that that's super fun. You know, I've had students go to Hawaii. I've had students that do international field work, and that's something that we're going to be looking into, to being able to offer at KGI. You know, you could go to another country and do some field work. Fantastic, right? Students go to the East Coast, Midwest, kind of everywhere. So we are working on trying to get some of those agreements with other states so we can provide kind of that larger range of fieldwork experience, because I think it's valuable.
Yeah, that would be cool.
Yeah, and practicing in different areas, like when you get into the world of OT, you learn there's like West Coast OT and there's East Coast OT, and there are things that we differ on, down to like treatment interventions. So I think it's super helpful to be able to get that exposure. Something that I didn't talk about that I wanted to share is that with this idea of community-based practice and emerging practice areas, I've felt like college students have so much need for occupational therapy around stress management and time management. It's a very stressful time. It's a time of transition. So at KGI, we currently have an OTD resident who is already an occupational therapist, and she's getting her doctorate, and she is providing one-on-one intervention to our students at KGI, providing occupational therapy for them, and really helping them look at how are they engaging in their daily occupations. And so the hope is that this position the resident is going to turn into a full-time paid occupational therapy position at KGI, and we will take more residents, and then we will take fieldwork students. So our students, you might have a fieldwork where you work with college students, with maybe you're working with the student athletes at the Claremont colleges. I've already been talking to some of the people in the athletics department, right? Because student athletes have so much need around how do they manage their time and stay healthy and manage their stress and deal with injuries and all that sort of thing, right? So I'm trying to build an infrastructure where there's just lots of opportunities to do these unusual fieldwork experiences. Yeah. We have 2 more minutes. Any other questions?
I have a quick question.
Sure.
Will the application process be through OTCAS?
Yes.
Okay.
I got an email from OTCAS on Monday morning, and they said, we're ready to set up your portal. I'm like, yes. I know, that's like that, Kamika. That's right. So I've been working closely with the admissions team. We're going to be ready to go come July. And so the application will be through OTCAS.
Okay, awesome. Thank you.
You're welcome. Hi, Josh. It's nice to see your face. Any other questions?
Hello, nice to see you too.
Yeah, nice to meet you. Nice to meet all of you. All right, well, I want you to feel free to reach out to me if you have any further questions. I know Kamika put her email in the chat, and I can give you mine here. But if anything comes up, please feel free to email me. And really check out our summer program. Last summer, we had 114 participants from literally all over the world. It was amazing. Lots in the United States, but a good chunk from Canada. We had someone in Greece and India and all over. And it's just a great place to learn about OT and to meet other potential OT students, people who are thinking about doing the profession. So join us during the summer. Applications are open. So thank you, Kamika, for sticking that in there. So it was a pleasure to spend this last hour with you. Best of luck to you on your choices that you have to make and your professional trajectory. So take care, everyone.
Much.
You're welcome.
Bye.
Thank you.
Bye.
Thank you so much for joining us today.
Thank you, Kamika.